really good at.
So how do you find out about
So
me?
I was on a work trip in Las Vegas, and we took our entire team to the Speedway, the Vegas Speedway. So they have go-karts that go like 60 miles an hour.
Wow.
I'm very competitive, and I was doing really well. And I said, you know, how can I get to be number one? Because I kept falling in number 3 with like 25 people. They said, well, don't break around the first bend. So I didn't, but I hit it straight on.
So you professional driver?
No, well, no.
So I should.
No. I'm not a professional driver, no. But I hit it in such a way that that instead of like your typical whiplash, my entire spine went sideways like this, and I felt a bit of a pop. And since then, I can't touch my hands to the ground, and like just laying down, just everything hurts. I got a therapeutic massage yesterday before I left Las Vegas, and it didn't really help much. So I think some things are out of whack.
Which area? Show me.
So I feel it like this is the start,
Oh,
and then
okay,
it
okay.
goes up and down, and then when I cough or sneeze, I can like it hurts.
I see. Oh, okay. I see. Okay. By the way, how do you find out about me? Google?
Well, I did, but I typically like to go to sports, people who handle like injuries, like sports injuries, because I feel like they're a different kind of chiropractor. Better.
Okay.
And I've been to some in my lifetime, so I saw your reviews, and I kind of saw that you have worked with. I mean, sports injuries are pretty extensive, so I felt like you probably would be able to help me better and quicker than a traditional chiropractor.
Okay, so you go to traditional chiropractor. What do they do?
I've never really had success with traditional chiropractors. It's always been chiropractors who specialize in like pain management and with sports and things like that. Because I think they know like the myofascial tissue a little bit better, along with this, with you know the traditional cracking and popping and things like that. So I just have felt a little bit like that genre is just better for me. Traditional chiropractors have never really helped me.
Okay. I see. So I can tell you, I have the machine. It's called Focus Shockwave machine. I mean, like you can go Google it, go search it. For the whole KD area, only one MD and my team have this machine.
Right.
So that's why I think I told you before. So that's why NFL pay come here, Olympic coach pay come here. Okay. So so you find out about me just Google or you search?
Yeah, well, I specifically search for like sports medicine, chiropractor, stuff like that, just because I know that if I'm injured, that traditional chiropractors don't really help those kinds of injuries. People who, I mean, these people get injured all the time.
Yeah, for sure.
And so it's just a different kind of way to practice, I think. So yeah, I looked you up specifically, how close you were in proximity to my house, and your reviews and all that stuff, and then that's why I chose you.
Okay, good. Okay, and then so this is informed consent, right? I'm taking X-ray for you. I need your permission, right?
Yes.
Okay, so like just pin and sign every single page, and then like in here just circle the area where you feel the pain. So right now from 1 to 10, 10 is worst pain. What's your level? 4, 5, 5, 6? Like.
Oh, I would say this is a good constant 7 or 8.
7, 8?
Yeah, I have a very high pain tolerance though. So this is. I knew after a week that I needed to see somebody because it wouldn't go away.
Oh wow! So it's been 1 week already.
Yeah.
Wow, 7 or 8 pretty high.
Yeah. Well, I'm a mom. I just keep going.
Okay.
So.
I see. Like, do you have high blood pressure, diabetes?
No.
No. Okay. And then like, so make sure you sign every single page, right? And
sign initial. Yeah.
So you're having migraine too?
Well, I mean, I think that everything is connected. So I'm just having like this area just is always like low grade, like migraine.
And then all the way, and then you have sciatica?
Well, I think it goes down. I think it goes down a little bit. I think everything's connected. So whatever hit, I can feel a little bit in my hips. So I don't know if that's sciatica or not.
Okay.
You let me know.
Yes. So can you like mainly one side, right? One side here.
Yeah.
One side, and then go all the way down. Like so, if I patch it, you feel pain? Okay, how about like lean backward, like?
Oh yeah.
More like lean backward, more pain, or lean forward? Which one is more pain?
More pain forward.
More pain forward.
Yeah. More pain forward.
And then.
Right. So here, let me put this away. So leaning. So if I'm like leaning back, it hurts here. Right. So if I lean back too far, I can feel it shoot here.
Okay.
And then I can go, that's right there. That's it. It shoots right here.
Wow. Okay.
That's
And then
about all I can go.
I see. Okay. Oh, have a seat first. Okay. Sit down. And then like turn. How about turn one side? Anything is okay, right?
I can feel it, but it's not as bad as.
Okay. How about this side? It's okay.
It's about the same. Yeah. I feel like the twist, like it's slightly uncomfortable, but nothing like bending over or bending backwards.
Okay. And then so you say hip and low back, like hip.
Yeah, so the hip and then it shoots up, and that middle area is right where it hurts the worst, but then it kind of travels up and down.
Okay, I see. Okay. So are you taking medication? No.
I went to an herbal shop and I had, what did I get? I got, I think like a little kratom liquid thing yesterday in Vegas before I left, so I thought it would help the plane ride. It didn't.
Okay.
And I took aspirin most of the week. Nothing's helping. No aspirin, no ibuprofen. So it's not cutting through the pain.
Okay. I see.
Breathing in, I kind of feel a little bit of like if I breathe in or sneeze, like there's a little bit of a sharp pain, like in the back area.
I see. Okay. Like penis sign, yes. Okay, and then one more page.
And I mean, I think my hips just in general are out of whack. I have 6 kids, so I think the hips just always kind of feel.
Yeah, first way, okay, this way. Oh, okay. And then, yeah, like this. Okay, let me make sure, okay, so, okay, stay here, don't move. Lisa, you can face the light here.
Face the front?
Yes. Okay. Okay, you can step back a little bit. Okay. Move this way a little bit. No, whole body. Okay, good. Okay, Lisa, so this one is AP open mouth, so you need to open your mouth. I know it's this is okay, this is okay.
No, I have gum in my mouth.
I know. So like just open your mouth, look straight, don't move, okay? Yes. Okay, you can close your mouth now, relax, okay, yes. Again, okay. Lisa, this time hand and elbow. Yeah, perfect. How do you know?
I just figured.
Okay, good. Okay, so like stand. Oh, good. Okay, perfect. Okay, stay here.
I in doctors a lot with my son, so I kind of figure.
Okay. Okay, you can relax a bit, but you can keep in this position. Okay, just relax a little bit. Okay.
We're looking at ribs, I take it, from this angle?
Yes. take a lower back X-ray.
Again? Same?
Oh yeah, yes, Sam, yes. Okay. Oh, you can look. Okay, good. Okay, move forward a little bit. Okay, okay, step. Okay, good, perfect. Okay. Okay, you can lower down your hand now. Lower down your hand. Okay, and then facing the okay, and then step back a little bit. Oh, good, perfect. Okay. Like all this green color is normal, red color is not normal. Okay, normal should be you can see the curve.
Right.
You can see the curve like a 42 degree. Like this is the curve. Okay.
And everything is spaced fairly evenly.
Yes, and then like this is stage 1, phase 1 degeneration. Okay, the neck will be so straight, right? So. Okay, yeah, take deep breath in, inhale, exhale. Okay, one more time, inhale, exhale. Okay, one more time, inhale, exhale. Okay, good. Low back inhale, hold, okay? Okay, yeah, turn body sideways.
Okay. That one scares me. The sideways.
Okay, good.
I can feel that.
Okay, good. Get some chest and thrust, good. This hand, grab my elbow, okay? Yeah, low back side, yeah, the other side.
Okay. And a little
Oh, so you be Hebrew?
a little bit, yeah.
Oh, what?
They're much better than me.
Okay. Okay, good.
Oh,
Okay.
that one did a bit more than the other one.
Oh yes. Okay, scoot aside a little bit. Okay, good. Okay, good. Stay
Right
here.
here?
Yeah, stay here. So. Nice. Good, yes. I give you a couple seconds. Okay, so yeah.
Oh, wow.
Nobody adjust you like this? No.
Huh?
Like you say you went to chiropractor before. Do they adjust you?
They've adjusted me. I've never had that much happen in that kind of an adjustment.
Really? Never? Oh my god. Okay, good. Okay, let me do the other side. Yeah, because you saw X-ray, your neck is so straight, right? So I didn't get a curve back. Okay.
No, always I usually have a pinch nerve right in my scapula.
Oh.
Yeah.
Okay. Make sure my nice jump so okay, good. Oh, nice. Good.
That released so much.
And then slide down a little bit. Okay, a little bit more. Oh, good. Okay, perfect. Okay, yeah, lift up your head a little bit. Yes.
Okay.
Oh, you.
I've seen
you see, you took me to.
before, but
yes.
I'm nervous.
Okay, I'll be super gentle. Okay, so just do some traction. Okay. Okay, good.
Okay, that's good.
Okay.
Wow.
Yeah, stay here a little bit. Like take deep breath in, inhale, exhale. Like you feel anything move, neck, upper back.
Yes, so much.
So much. Which area?
I think it started at the lower, right above the hips,
Uh-huh.
the vertebrae, and then it went all the way up to, I don't know, that little hump that you have right there.
Oh, so you whole, pretty much the whole spine move.
My whole spine just.
Okay, I see. Okay, that's good. Okay, Lisa. Okay, so you have the particle posture. Okay, you mentioned about mid back pain, low back pain. So when you get up in the morning from your bed, okay, make sure you don't want to keep doing the sit up position. Turn your body sideways is easy. Yeah, good job. Yeah, turn sideways. Using elbow hand push yourself up is easier. So yeah, you just do like this.
Okay.
So and then you don't want to keep doing the sit position. You saw a low back this is not X-ray, right? So especially L5 bone, S1 bone decrease so much.
Well, I notice when I'm exercising and I'm lifting, this area never feels good.
Okay.
And I think that by doing certain exercises that it would.
Oh.
So maybe I need to figure out how to decompress that a little bit more as well.
So you lift heavy weight too?
Yeah, I do. I do squats and I do deadlifts and all of that.
Okay, so for at least for this couple of months, try to don't do any
Yeah,
squat.
well, I figured I'm down for a little while.
Okay,
I'm not
okay.
going to try to do that with my back pain. But
Yeah, so because you mentioned low back pain already, your low back is injured, right? Mid back, low back is injured. So like don't do any squat, like deadlift, like all this stuff. At the same time, okay, especially female. Oh, do you need your workout sets?
Yes.
Okay, good. Explain to you, okay? As we age, as we get older, right? So like you saw X-ray, your disc compress a little bit, right?
Yeah.
When the disc is compressed, it pinch your nerve. So
Yeah.
what I do right now, I try to decompress your spine, decompress, make more space for all this nerve, okay?
Right.
So sit all the way back. Good, okay. Oh, be careful, this metal here. Yeah. No, don't worry, people.
Okay, I was trying to take off my shoes.
Oh no, it's okay. So do like this, okay? Like under the hair, skin or skin, grab it tight.
Okay.
So I try to decompress your spine. I try to carry you on my back, okay? So let's see if I can do this one. Relax upper back, okay? Okay. Oh, so make sure your head, okay. Yeah.
Try to do that.
Yeah, good. Okay, and then give some space. I know it's difficult. So relax upper back, okay?
Okay.
So okay, I know. Okay, and then make sure relax upper back, relax.
Oh.
Okay, good. Little bit.
Yeah.
Yeah, upper back, mid back. So your upper back, mid back is very tight. I try to decompress your spine. Yeah. So.
No, I feel that released. That released.
Okay, tell me how you feel. A little bit better.
I do. I came in here like I've got I haven't slept in almost a week because of the pain. I feel good. I feel like my head doesn't feel as tense. That headache that I told you about is almost completely gone.
Oh wow!
Yeah, I know. Like it was like very compressed here, and now I feel like you've taken off my head and put it back on.
Okay.
Like,
so I support YouTube, right? I support YouTube. All the head is gone.
Sometimes you feel like you just want to remove your head for a second and then put it back on. And I feel like that's been done.
Oh, nice.
Like my shoulders don't feel like they're up here. I feel a little bit lower.
Okay.
And I'm not feeling that. That pain like really every second.
Oh,
like
nice.
it's still there, but it's less.
Less.
A lot less. Yeah. Oh my gosh.
Okay. Good.